What is the link between metabolic syndrome and inflammation? Imagine your body as a busy city where different systems work together to keep everything running smoothly. When one part starts to malfunction, it can cause traffic jams and problems elsewhere. That's similar to how metabolic syndrome and osteoarthritis are connected through inflammation. Metabolic syndrome is a group of conditions like obesity, high blood sugar, high blood pressure, and abnormal cholesterol levels. These issues often happen together and can lead to increased inflammation throughout your body. This low-grade, chronic inflammation is not as obvious as a sudden injury but can cause long-term damage. In osteoarthritis, the joints wear down over time, but inflammation plays a big role too. Instead of just mechanical wear and tear, inflammation causes the joint tissues to break down faster. This inflammation involves molecules called cytokines, which are like tiny messengers that tell the body to react. These cytokines, such as interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha, are produced by joint cells and immune cells inside the joint. Now, here is where metabolic syndrome comes into play. It increases the levels of inflammatory mediators circulating in your blood. These mediators can activate pathways inside joint tissues, like the nuclear factor kappa B pathway, which promotes the production of enzymes that break down cartilage. When cartilage is damaged, it leads to more inflammation and pain. Excess fat tissue, especially around the knees and hips, produces substances called adipokines and cytokines. These substances directly influence joint cells, making them more inflamed and speeding up cartilage loss. This is why people with obesity are at higher risk for osteoarthritis. Metabolic syndrome also affects immune cells. It causes immune cells like macrophages and T cells to become more active inside the joint. These cells releases more inflammatory molecules, creating a cycle of ongoing inflammation and tissue damage. Oxidative stress is another factor. It damages joint tissues and releases molecules called damage-associated molecular patterns. These molecules activate immune receptors on joint cells, further fueling inflammation. All these factors cause joint cells called chondrocytes to change their behavior. Instead of maintaining healthy cartilage, they start breaking it down and growing abnormally. This process worsens osteoarthritis over time. Managing metabolic syndrome by controlling weight, blood sugar, and cholesterol can help reduce this inflammation. Lifestyle changes like healthy eating and exercise, along with medications, can slow down joint damage. So, the link between metabolic syndrome and osteoarthritis inflammation shows that osteoarthritis is not just about joint wear and tear. It involves complex biochemical and immune responses influenced by your overall metabolic health. Understanding this connection helps explain why people with metabolic syndrome often have more severe joint problems and inflammation.